What is VOXZOGO used for? VOXZOGO is a prescription medicine used to increase linear growth in children with achondroplasia and open growth plates. VOXZOGO is approved under accelerated approval based on an improvement in annualized growth velocity. Continued approval may be contingent upon verification and description of clinical benefit in confirmatory trials. VOXZOGO may cause serious side effects, including a temporary decrease in blood pressure in some patients. To reduce the risk of a decrease in blood pressure and associated symptoms, dizziness, feeling tired, or nausea, patients should eat a meal and drink 8 to 10 ounces of fluid within 1 hour before receiving VOXZOGO. Please see important safety information at the end of this video.
Before you begin, you will receive training from your child's healthcare provider on how to prepare and administer VOXZOGO. Be sure to read the VOXZOGO instructions for use, or IFU. Always follow instructions provided by your child's healthcare team, and talk to your child's healthcare provider if you have any questions about how to inject VOXZOGO the correct way or about your child's medical care. Your BioMarin clinical coordinator is also available to answer any questions about VOXZOGO. In addition to this video, you can also refer to your welcome kit for more training support as well as shipment and storage information. Please see the important safety information at the end of this video. In this video, you will see how to safely prepare and inject VOXZOGO for your child. Starting a new therapy is an exciting step. This video will help familiarize you with the whole process. This video is divided into 3 parts. Get started. We'll go over the materials you will need. Get ready. We'll explain how to prepare the VOXZOGO injection. In Get VOXZOGO, we'll illustrate the injection process, including how to select and prepare the injection site. Before we get started, remember to PRE check throughout. Pause as often as you like. Rewind and review until you feel comfortable. And explain to your young one what you're doing to keep them engaged. When you see the pre-check icon, take a close look at the section of the IFU and reach out to your child's healthcare provider with any questions before continuing with administration. Once you're ready, start by finding a nice, calm, clean environment where you and your child feel comfortable. Make sure your child is well fed and drinks 8 to 10 ounces of fluid within 1 hour before the injection to help avoid feelings of dizziness, tiredness, or nausea. Part 1. Get started. Always wash your hands and clean any surface the medicine or materials could touch before handling VOXZOGO. Next, gather all the materials you need on a flat, clean surface or placemat. 1. A vial with medicine powder that has reached room temperature. 2. The needle with the blue tab, called the diluent needle. 3. The pre-filled diluent syringe, which contains sterile water to dissolve the medicine powder. It does not have a needle attached. Later, the diluent needle will be attached to the pre-filled diluent syringe, so the sterile water can be injected into the vial. Do not use this syringe to give the injection. 4. An injection syringe with capped needle. 5. 2 alcohol wipes, some gauze or bandage, and a sharps container that can safely hold used syringes, needles, and vials. A pharmacist can help you find these items. Verify you have the correct dosage by checking the label and color of the vial's cap. This should match the prescription provided by your child's doctor. Inspect the vial and materials for any sign of damage or contamination. Do not use VOXZOGO if it is damaged or expired. Next, we will go over how to mix the sterile water with the medicine powder to prepare the injection. You may do this section before involving your child, unless they would like to watch. Part 2. Get ready. Step 1. Remove the cap of the vial and wipe the exposed stopper with an alcohol pad. Do not touch the vial stopper after you clean it. Step 2. Take the pre-filled diluent syringe and gently bend the cap until it snaps off. Step 3. Hold the pre-filled diluent syringe and twist the diluent needle straight onto it until it no longer twists. Make sure the syringe and the needle are tightly attached to prevent leakage. Do not use the diluent syringe to administer the injection. Step 4. To remove the needle cap, pull it straight off without pointing the exposed needle at anyone. Then, insert the needle straight down into the middle of the bullseye on the vial stopper. Be careful not to touch the side walls. Do not put your thumb on the plunger when inserting the needle into the vial. Once the needle is fully inserted in the vial, use your thumb to slowly push the plunger rod down to inject all the sterile water into the vial. Be careful not to push too quickly, or it may create bubbles. Also, be mindful not to push the blue tab until all the sterile water is in the vial, or the needle will retract too soon. Step 5. Once there is no more sterile water in the syringe, remove the diluent needle from the vial. Now, press the blue tab to retract the needle. Continue being mindful during these steps. It's important to handle the exposed needle with care. At this point, dispose of the empty diluent needle and syringe in your sharps container. Do not touch the tip of the needle. Step 6. Gently swirl the vial until the powder completely dissolves. Do not shake to mix it, or you may create bubbles. And do not touch the vial stopper. Examine the vial to make sure the medicine is clear to yellow, not cloudy and particle-free. If it looks cloudy, discolored, or contaminated with particles, discard the vial. See the IFU for instructions on discarding vials, needles, and syringes. Once mixed, use the medicine right away. It must be used within 3 hours. Step 7. Take the injection syringe out of the carton. Remove the cap in the same way as before, straight up and off, while being careful not to point it at anyone. Completely insert the needle straight through the middle of the bullseye on the vial stopper. Be careful not to touch the stopper sides or bend the injection needle. Step 8. Securely and carefully hold the vial and syringe together in place. Now, turn the vial upside down with the needle still inserted so the vial is on top. Note suggested finger placement. Support the vial with your finger to avoid bending the needle. Step 9. While looking through the channel to ensure the needle tip stays in the medicine, slowly pull the plunger rod back to draw the prescribed dose into the syringe, avoiding air bubbles. Continue to support the vial using your finger. Check the prescription label for how much to draw up. Step 10. Look closely at the injection syringe for bubbles. Remove large air bubbles by gently tapping the bottom of the syringe and carefully pushing the plunger to get air bubbles back into the vial. Repeat steps 9 and 10 until the injection syringe has the prescribed dose with no large bubbles. This step can feel strange at first, but it will get easier with practice. 1 or 2 small bubbles are acceptable. Step 11. Double check to make sure the dose in the injection syringe matches the dose prescribed by your child's doctor. Measure the prescribed dose from the base of the plunger as shown here. Step 12. Once you have confirmed the dose, slowly remove the vial by pulling it straight off the needle. Now, discard the vial in your nearby sharps container, even if there's leftover liquid. Part 3. Get VOXZOGO. Next, we will prepare the injection site and administer VOXZOGO while being careful not to contaminate the needle or drop the syringe. There are 7 VOXZOGO injection sites. For step 13, we'll select one spot for today's injection, the back of the upper arms. The other sites are the front upper thighs, about 2 inches from the belly button, and either side of the bottom. Make sure to use a different site from the day before. Do not inject into the same site 2 times in a row. Step 14. Wipe the injection site with an alcohol pad and let the skin air dry. It might be cold. Do not touch the site again before the injection. Avoid sites if you notice sore, red, bruised, scarred, hardened, or swollen skin. If your child is uncomfortable with a specific site, it's okay to select a different location for that day's injection. Just make sure not to inject into the same site 2 days in a row. Do not inject the medicine through clothing. Now that you have prepared the VOXZOGO syringe, as well as selected and cleaned the injection site, just 4 more steps to go. If it is difficult to approach the injection site at first, it's okay to pause this video and take some time to talk with your child about how they're feeling. If they touch the site, just clean it once more with an alcohol pad and let it dry. Sometimes their favorite distraction can help. Everybody ready? Step 15. Give the chosen site a gentle pinch to bunch up the skin around the site for the injection. Step 16. Quickly insert the injection needle all the way into the skin at a 45-degree angle. Step 17. Release the pinch and use both hands, one to stabilize the syringe and the other to push the plunger. Slowly push the plunger rod until all the medicine has been injected and the syringe is empty. You will feel a slight resistance once the syringe is empty. Next, give a final push on the plunger to retract the needle into the syringe. After the needle retracts, VOXZOGO has been successfully administered. This will help prevent needle accidents and make sure your child receives their full dose. Take a close look at the injection site. If it's bleeding a little, gently press it with gauze and apply a bandage. After every injection, have a short talk with your child about how they feel. If your child experiences dizziness, tiredness, or nausea, you should call your child's doctor or healthcare provider. Then get your child to lay back with legs raised. Step 18. In order to safely dispose of VOXZOGO materials, put your used or expired vials, needles, and syringes in an approved sharps disposal container right after use. Do not throw items away in household trash. When your sharps disposal container is almost full, follow your community guidelines for disposal. Do not dispose of loose materials or a full sharps container in your household trash unless your community guidelines permit this. Do not reuse sharps disposal containers. Next, we'll go over how to properly store VOXZOGO. Store it in the original package to protect from light. Store VOXZOGO before mixing in a refrigerator at 36 to 46 degrees Fahrenheit, 2 to 8 degrees Celsius. VOXZOGO may be stored at room temperature at 68 to 77 degrees Fahrenheit, 20 to 25 degrees Celsius, for up to 90 days before it has been mixed. Do not return VOXZOGO to the refrigerator once it's at room temperature. Discard if not used within 90 days. Do not freeze. Store VOXZOGO out of the reach of children. Do not use after the expiration date. After it's been mixed, use the medicine right away. Mixed VOXZOGO must be used within 3 hours. The information in this video can also be found in the IFU that came with your child's VOXZOGO. Review the IFU before administering VOXZOGO and after every refill. To see a printed version of this video, review the dosing and administration guide included in your child's VOXZOGO welcome kit. If you have any questions, contact your child's healthcare provider. Your BioMarin clinical coordinator is also available for product and injection education, or you can visit voxzogo.com. Congratulations! You have prepared and administered today's VOXZOGO for your child. You'll become more familiar with the process with every day. Thank you for learning about the VOXZOGO administration process. Keep watching for the important safety information.
Important safety information. What is VOXZOGO used for? VOXZOGO is a prescription medicine used to increase linear growth in children with achondroplasia and open growth plates, epiphyses. VOXZOGO is approved under accelerated approval based on an improvement in annualized growth velocity. Continued approval may be contingent upon verification and description of clinical benefit in confirmatory trials. What is the most important safety information about VOXZOGO? VOXZOGO may cause serious side effects, including a temporary decrease in blood pressure in some patients. To reduce the risk of a decrease in blood pressure and associated symptoms, dizziness, feeling tired, or nausea, patients should eat a meal and drink 8 to 10 ounces of fluid within 1 hour before receiving VOXZOGO. What are the most common side effects of VOXZOGO? The most common side effects of VOXZOGO include injection site reactions, including redness, itching, swelling, bruising, rash, hives, and injection site pain, high levels of blood alkaline phosphatase shown in blood tests, vomiting, joint pain, decreased blood pressure, and stomachache. These are not all the possible side effects of VOXZOGO. Ask your healthcare provider for medical advice about side effects and about any side effects that bother the patient or that do not go away. How is VOXZOGO taken? VOXZOGO is taken daily as an injection given under the skin, administered by a caregiver after a healthcare provider determines the caregiver is able to administer VOXZOGO. Do not try to inject VOXZOGO until you have been shown the right way by your healthcare provider. VOXZOGO is supplied with instructions for use that describe the steps for preparing, injecting, and disposing VOXZOGO. Caregivers should review the instructions for use for guidance, and anytime they receive a refill of VOXZOGO in case any changes have been made. Inject VOXZOGO one time every day at about the same time each day. If a dose of VOXZOGO is missed, it can be given within 12 hours from the missed dose. After 12 hours, skip the missed dose and administer the next daily dose as usual. The dose of VOXZOGO is based on body weight. Your healthcare provider will adjust the dose based on changes in weight following regular checkups. Your healthcare provider will monitor the patient's growth and tell you when to stop taking VOXZOGO if they determine the patient is no longer able to grow. Stop administering VOXZOGO if instructed by your healthcare provider. What should you tell the doctor before or during taking VOXZOGO? Tell your doctor about all of the patient's medical conditions, including if the patient has heart disease, cardiac or vascular disease, or if the patient is on blood pressure medicine, antihypertensive medicine, if the patient has kidney problems or renal impairment, if the patient is pregnant or plans to become pregnant. It is not known if VOXZOGO will harm the unborn baby. If the patient is breastfeeding or plans to breastfeed. It is not known if VOXZOGO passes into breast milk. Tell your doctor about all of the medicines the patient takes, including prescription and over-the-counter medicines, vitamins, and herbal supplements. You may report side effects to BioMarin at 1-866-906-6100. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088.